All right, I think I'm going to get started. Welcome to everyone. As I said, my name is Deborah Bell. I'm the Director of Education for the University of Washington Osher Center for Integrative Health. I also am an integrative medicine family physician, and I practice at our Osher Center doing integrative medicine consults, and I provide integrative medicine primary care at the UW Northgate Clinic. And I'm welcoming you to our Women's Health Series Part 2, Nourish and Balance. So just to tell you a little bit about our Osher Center, we offer a number of different services. Really paying attention to people's well-being is our priority. On this screen, you can see our director, Dr. Iman Maj, who is a integrative medicine family physician and acupuncturist, providing some services for people. And we offer, as I said, integrative medicine consults, naturopathic consults, and massage therapy, acupuncture. And within all of those things, we pay attention to that all of the tools that we use in integrative medicine. We are very grateful for the Chachi Ming Foundation. This is possible for you to have this free educational opportunity through an endowment through the Chachi Ming family. And just a little bit about the Osher Center. The University of Washington Osher Center is one of 11 academic centers, 10 of which are in the US, and one is the Karolinska Institute in Sweden. And we all are members of the Osher Collaborative, so we get to interact with all of these top integrative health experts from around the country. And we're very grateful to be part of the Osher Collaborative team. And with that, I'd like to introduce our presenter today. I'm very excited. I've known Dr. Ann Kennard for several years. We have now presented together at some conferences and beginning to collaborate, which is so exciting to me. And she's a triple board certified in obstetrics and gynecology, integrative medicine, and women's health. She holds a Bachelor of Science in Nutrition, is a clinical herbalist and registered yoga instructor, and completed fellowships in integrative and contemplative medicine. She chairs the Menopause Committee for the American College of Lifestyle Medicine and serves as a national delegate to I believe it's the American College of Obstetrics and Gynecology Wellness Committee, ACOG is what we call it, and is program director of the OBGYN residency program at Marion Regional Medical Center in California. She speaks nationally and internationally, has authored integrative women's health curricula, and is a brilliant practitioner and compassionate and full of wisdom. So I'm very excited. And with that, I will stop sharing and turn off my video and send it to you, Anne.
Thank you so much for the kind introduction. Before all of those things, my training was in nutrition. And I did my bachelor's and master's work in nutrition. And that really was my first love. And I love food. I love good food. I've always loved to cook, and a special shout out to my mom who's here today, who let me cook as a child and really fostered that development of this non-traditional path towards medicine. And so with that, I'm so happy to talk with you today about culinary medicine for women's health, because food matters so much, and it's not something that's generally talked about within women's health or, most medical training. And we all want to eat stuff that tastes good. And I wanted to focus particularly on food for women that was easy to make. I work full time. I have two little kids, and I need stuff that I can make quickly, that will last in the fridge for a long time, that I can reheat and eat with one hand and a paper towel while I'm driving those guys to school, and in ways that support women's health across the lifespan. So that's what we're going to talk about today, and we'll have plenty of time for questions at the end, and I'm really glad to answer whatever you'd like to talk about. Okay. Some disclosures for my consulting work and a nice box breath. Inhaling for 4, hold for 4, exhaling for 4, hold for 4. And these are our objectives today. We're just going to cover a broad overview of of women's topics, both pre and postmenopausally. And so, just as a very brief review, where most folks in the US are starting is with a standard American diet from refined and processed foods, um, very few plant based foods, half of which are French fries. And there's been a number of diagrams and efforts with different public health agencies, et cetera, to move it forward. This is a nice example of that from the Harvard School of Public Health. This is a nice one, Healthy Eating Plate. And then moving that forward even more with the American College of Lifestyle Medicine towards a whole food plant-based eating plan. And a lot of times people have, questions about particular diets, and we can certainly cover that. But I think what matters most are the broad strokes of not getting locked into one particular thing, but coming back to this theme of a whole food, plant forward style diet, and in ways in which are doable and supportive and sustainable, and people's kids will eat, that that's really what matters most. In terms of culinary medicine, why I love culinary medicine so much is, like I said, I love to cook, and we all want to eat stuff that tastes good. And the intersection um, of that is a real passion for me. And I love fresh foods. I love going to the farmer's market, cooking and eating seasonally. And I'm from California, so that's somewhat of a luxury, of living there, but really bringing that into a way that works. For example, one day of the week, like making something that will last the rest of the week, and really utilizing lots of different plant foods, um, colors, tastes. This is a favorite recipe for me that I wanted to share with you for this dark chocolate bark. That's a high phytonutrient recipe. And if I could have made this for you, I would have. I gave a similar talk at ACOG, and I made a suitcase full of this and took it across the Pacific to serve it at a conference. But this is super easy to make. It lasts well in the freezer even, and is a nice thing that is healthy to have on hand. So we'll go through just kind of highlights of culinary medicine for both pre and postmenopausal GYN things, as well as a little bit of touch on pregnancy as well. And my intention with this is to give you a broad overview and the highlights. Each of these could be their own individual talk, but I just want to touch on what I think is the most important thing from my perspective as an OBGYN and integrative medicine physician with nutrition background. So there's a lot about PCOS out there. For review, PCOS stands for polycystic ovarian syndrome. And this is something that's been talked about a lot more recently. I see a lot on social media about PCOS, and there's a lot of expensive supplements out there. And, some of the supplements work well. And, I'm not disparaging it at all, but we always have to come back to food first and eating from a whole perspective. And for PCOS, it has such a profound impact. For review, PCOS is diagnosed best 2 out of 3, missed cycles, hair in places you'd rather not have it, and the classic appearance of the ovaries on ultrasound from unovulated follicles, meaning people are missing their cycles. But this is not an ovarian problem at its root. It's really a metabolic problem. And the newer nomenclature for it of metabolic reproductive syndrome, I think, is a lot better description of it. And from that, we start to see the roots then in how nutrition can be such a powerful role in treating it. And a lot of the, more general advice as well, lose weight, or, that will help restore the cycles. And that's true. But, how is that done best and what is the metabolic impact of specific endeavors. And for PCOS, the money really seems to be in a low glycemic index diet. And what that means is that the overall um, carbohydrate load and subsequent blood sugar rise is lower with things, say, with a lot of fiber when added to proteins and to fats, and higher glycemic index foods contributing to a higher glycemic index load meal would be things like that break down quickly, high sugar, high starch, things like that. And with those changes, we really see this is kind of a dense slide, but really meaningful differences in terms of all the things you would hope it to do. It does. So decreasing endometrial cancer risk, which is a downstream risk for PCOS, improving menstrual regularity, improving insulin sensitivity, improving metabolic indices like lipid panels, waist circumference, etc. And this is really impactful in terms of both future risk and day-to-day impact, including fertility. And I see a lot of women with PCOS concerned about fertility, and this is always where I start. And so these tips may seem minor, but I have seen them make a real difference for women with PCOS. And of course, there's a whole, you know, holistic approach to this beyond just the nutrition. But these minor tips of adding a healthy fat or protein to every meal or snack, like trying to get up to 10, ideally 15 grams of protein per time that someone is eating, looking for minimally processed foods. Lots of things have a health halo label on them about being whole grain, but what is the actual whole grain? Eating whole fruits, whole vegetables instead of more processed things down the way, like, apples versus applesauce. And I've seen this really make a difference for folks. One of the recipes I wanted to leave you with this is omega-3 fatty acids are super important. We'll see that over and over through the presentation. And people talk about high fatty fish or smash fish, but the ability of most people to deal with fish on a regular basis, for folks that are busy and maybe not comfortable with cooking fish, you can air fry it, and it's a real game changer. You can air fry it from frozen, because I find if you thaw the fish, like, it sits in the fridge for 5 days and then you throw it away and you worry about it smelling in the trash, and it's just not that great. But putting it in from frozen, put this kind of over with the olive oil and the garlic, paprika, salt, and pepper. And when I say minced or crushed with the garlic, this is a culinary medicine tip that I love. Increasing the surface area of the garlic and leaving it open to the air for a little while converts the garlic to have something called allicin in it, and that is really the most potent anti-inflammatory component of the garlic. And so by modifying how you prepare it, it really increases the impact of the medicinal properties of the food. And so that minced or crushed garlic over this, highly anti-inflammatory, which really is important for PCOS folks, and anyone with any underlying metabolic disease. And you'll see that too, like you hear about garlic for hypertension or hyperlipidemia, and this would go along with that too. And then the citrus avocado salad is really yummy. In terms of other culinary considerations for PCOS, utilizing vinegars can decrease the glycemic load. So 1 to 2 teaspoons of vinegar before a meal will bring down the glycemic load of the meal by close to 30%. Like, it's significant. And it doesn't mean that you need to knock back, some apple cider vinegar that doesn't taste good. This can be something that is on greens or roasted Brussels sprouts with a balsamic and oil on it. All of that counts. And when you add vinegars too, it prevents these glycosylated end products that are carcinogenic. And so that's a double improvement there. And then I wanted to mention cinnamon in terms of being something. And again, I see these in supplements, right? Like there's vinegar gummies or there's cinnamon as a supplement. But, an elderberry vinegar on the Brussels sprouts tastes amazing. And cinnamon on steel cut oats or overnight oats, something that you've, got a lot of other fat and protein in to really be a nice breakfast, has a significant reduction in sugars after the meal. I wanted to touch on endometriosis. I think that's another women's health topic that's getting some airtime recently, and I'm so glad to see it because before it really wasn't talked about. And I think a lot of folks assumed that their heavy, painful periods were normal. And, really they were probably falling more in the endometriosis slash adenomyosis bucket. So endometriosis is where the lining of the uterus, the endometrium, is living in places that is not the inside of the uterus. So it can be all through the pelvis, on the bladder, the bowel, the uterosacral ligaments. It can contribute to significant pelvic pain, heavy periods, painful periods. The lining of the uterus, too, can live in the muscular wall of the uterus, and that's called adenomyosis and can contribute to those same symptoms as well. And again, like this is something to be addressed holistically. And I'm a gynecologic surgeon. I do surgery for endometriosis. This is not something that I'm saying can be cured by food. There's a lot of medications and some newer too that are hormonal um, modulators that can be very helpful. And I also want to say that I've seen significant benefit in patients that have utilized a whole food, plant forward style, anti inflammatory style diet in the setting of endometriosis. And we see that in terms of um, omega-3 fatty acids, magnesium. This was from a Cochrane review, which is one of the most robust studies and recommendations made in terms of decreasing menstrual pain. Curcumin, which is the yellow pigment in turmeric, reduces both load and inflammatory response. And so in clinical studies, that was not only folks saying that their pain was less to them perceptually, but then when their gynecologists went in laparoscopically, they actually saw the lesion shrink and less of an overall burden in the abdomen and pelvis following use of curcumin. And along with that, I wanted to mention the microbiome in women's health. And again, this could be its own talk, but this is really applicable for endometriosis, for uterine fibroids, otherwise known as leiomyoma or leiomyomata. It's applicable for perimenopause and menopause in terms of how estrogen is resorbed or excreted, and it's applicable too for estrogen mediated cancers, things like uterine or breast cancers, because this gut uterus connection in the microbiome is that the estrogen is conjugated via this beta glucuronidase enzyme and either excreted or resorbed. And so, if somebody has dysbiosis, that glucuronidase pathway is altered, and there tends to be more of a resorption of estrogen that really should be excreted in terms of a healthy balance. And when we see that too, when folks have dysbiosis, it's not just that, like they also have gut permeability that affects the lipopolysaccharides, the overall inflammation, the production of short chain fatty acids, which has downstream metabolic impact, as well as immune impact, and really over the whole psychoneuroimmunologic spectrum. And so I think one of the key elements to addressing women's health holistically begins in the gut with the microbiome. And that's another reason I'm so passionate about nutrition and culinary medicine, because really that doesn't start with supplements. That starts with whole food, plant-based dietary patterns in terms of a wide variety of fibers and plant-based foods. Lignans, we'll talk a little bit about. Those are like woody fibers like what's in flax, and probiotic foods too. That, when you start to increase fiber, it can be hard on the gut. People have gas, and those probiotic foods help to kind of soften that transition to where folks can tolerate that increase in fiber more easily, as well as also contributing to a healthy population of that. Um, and one of the things that's interesting to me is this emerging research on dietary fiber and breast cancer, and that this may be one of those um, ways in which this is being modulated is the so-called estrabolome, or the microbiome estrogen overlap. And I think too, one of the papers I wrote covered this in terms of uterine fibroids, and same thing in terms of the size and problematicness, if you will, of the uterine fibroids in terms of serum estrogen and dysbiosis. And so, with that, I wanted to share this recipe with you. I love making these because they are really easy to make. They go in the fridge. You can freeze them. So, if you freeze them single file, and then you can put them like in a Ziploc bag in the freezer, and they won't mush together. They'll stay nice, and then they will revive well in the fridge. So, I like stuff that you can make a whole bunch of it at once and then have it on hand. And this is a nice example of the lignans. And so something that's really good for the microbiome with the flax that's in there. And ground flax is important because if you have flax seeds, they're just generally not digested that well. So the ground flax allows some absorption of the ALA, good fatty acids that are in there, as well as improving the fiber content, the rolled oats. With the nut butter, I really like peanut butter or almond butter. If you use a nut butter that's pretty oily, it will throw off the texture of these guys. Like, it has to be refrigerated or sticky enough to stick all the things together. So just keep that in mind. And if it's a nut allergy, sunflower seed butter can work well with this too. And the add-ins are nice. And this is a nice vehicle too for powdered supplements. Like, I see a lot of women taking a lot of supplements, and some of them, especially when we look at perimenopausal supplements, things like maca or ashwagandha, creatine. I'm hearing about all of these on social media now. That they're getting popular. But maca, for example, that's a nutritive root that's powdered. And so by nature, it just is kind of a lot of volume. And so if you're taking 3 to 5 grams of maca, or 5 grams of creatine, that's like 6 large capsules. And most people are not going to be, into that on a daily basis for very long. But these balls really hide that kind of powdered supplement well. And then, you're getting away from just taking capsules all the time, which is kind of nice. Kids really like these too. My kids like these. If you're putting it on dinner, you just need to have one that's like labeled mom's power pills and not for the kids. But these are a great snack for everyone. I did want to touch too on HPV and cervical dysplasia, because I'm seeing more supplements out on the market for that, and people asking about food sources. This data is emerging, and there's not as much out there as I like. Again, you have to assume a whole food, plant forward, anti-inflammatory style diet is going to be good for this, because there is plenty of evidence showing that it's good for immune health. And what we know about HPV is that it seems to be sort of like chicken pox and shingles, where if you have it, it probably doesn't really go away, but in the presence of a healthy immune system, it's dormant. And so things that optimize the immune system are going to be good in terms of um, optimizing this from progressing towards further dysplastic activity. In terms of the specific things that are out there, food wise or supplement wise, green tea, ellagic acid, which is in pomegranates, there's some data for both. the indole 3 carbonyls, so those are the things that give the sulfur smell to the cruciferous vegetables. So things like Brussels sprouts, cauliflower, broccoli, kale. Those eaten in whole foods are shown to improve the presence of cervical dysplasia in the setting of HPV. And then the medicinal mushrooms, particularly reishi and turkey tail mushrooms, and the mushroom derivative from those, which is abbreviated AHCC. There's plenty of supplements with those in it, many of which are very expensive. But also, just with this idea again of whole foods first, coming back to the idea of cooking with medicinal mushrooms. You can cook with reishi or maitake or shiitake, and utilizing that too in terms of HPV clearance. This picture on the bottom right is the turkey tail mushrooms, and I love how those look. They have like that little turkey tail with all the colors in it, and they're up here in the Pacific Northwest, and they grow in the rainy season where I live in California. They're really fun to find. This is my recipe for roasted Brussels sprouts, and learning to roast something is a powerful tool because if you've roasted one veggie, you can roast them all. The basic on it is the veggie goes in with some olive oil, which is okay to use because it's not heating up enough that it's going to oxidize or turn pro-inflammatory. Some kind of seasoning on it. Salt, we talked about vinegars being beneficial for PCOS, and the vinegar caramelizes on the little like crispy bits on the Brussels sprouts and taste really good. If you add a little bit of sugar, like honey or maple syrup, it'll give you that really nice further caramelization. But basically, you can do this to any veggie, like carrots roasted with some honey and thyme on it. That's really wonderful. You can roast cauliflower with some oil and curry spices, but it's all basically the same thing. Everybody goes in a 400-degree oven. It's just variable on the time based off of how dense or rooty something is, and it comes out really lovely and heats up well too. You can revive these guys in an air fryer and they taste great. All right, some considerations for pregnancy and postpartum. So just a couple highlights that I think I'd like to leave folks with for pregnancy. I get a lot of questions about probiotics in pregnancy. And I think that it's worthwhile in terms of correlations with reduction in childhood asthma and allergy when taken at 36 weeks. It's also helpful in terms of promoting healthy urogenital flora in the birthing person, preventing recurrent UTI if that's an issue for folks during pregnancy. And the particular strains that are studied for this are the Lactobacillus rhamnosus and reuteri, or Lactobacillus GG is another name for that. This US probiotic guide, this is hyperlinked here, is a really nice guide for looking up anything related to probiotics, and is kind of fun to look around on in terms of what different strains or products are studied or recommended for different things. But again, this doesn't need to be taken in a supplement form. Kefir, yogurt, those are, almost entirely Lactobacillus rhamnosus and or reuteri. And then truly fermented veggies, not the quick pickle, but things like sauerkraut, kimchi, etc., are going to be good sources of that as well. People ask me about kombucha in pregnancy just because it has like that just trace amount of alcohol. I don't honestly worry about it. I think it's so minor that it's fine. In terms of micronutrients, I wanted to touch on iron and iron-rich foods during pregnancy. Iron taken as a supplement can be really hard on the gut, and most supplements are in the ferrous sulfate form. Ferrous glycinate, fumarate, bisglycinate are all going to be better absorbed. Taking it with vitamin C will further enhance its absorption. And looking at foods in terms of, red meat containing iron, dark leafy greens, molasses. And this is so important too with the prevalence of iron deficiency greater than previously thought. There was an article that came out about 18 months ago in JAMA on adolescents, showing 40% of adolescents with low iron, as defined by low ferritin stores and iron studies. And, in my patient population, we have a lot of adolescent pregnancies. This is really um, paramount and such that, we often use IV iron even. But again, coming back to food sources first when possible, cooking in an iron pan or with an iron fish. I just wanted to put that on the radar for pregnancy. And then another thing to speak on with pregnancy that's an emerging research field right now is choline. And so this conversation started more recently. It was just in the last 5 years or so that this started to be mandated by the American Academy of Pediatrics and recommended by the American Medical Association. And the new recommendation in 2020 was 550 milligrams of choline. For reference, one egg yolk has about 200 milligrams of choline, so a couple eggs a day. This is also found in organ meats, but most pregnant folks are not super into organ meats. And so I do think it probably is something that is worth supplementing unless somebody is really into eating a lot of egg yolks. And the new data coming out from the University of Colorado is showing that there's about a doubling in benefit when that is increased from 550 to 900 milligrams. And so for the fetus, it has enduring cognitive and neurodevelopmental benefits, including reduction in incidence and severity of neurodiverse developmental disorders, severe autism, ADHD, etc., as well as eye development as well. But choline is good for all brains. We look at acetylcholine for folks after stroke recovery, kind of going to the other end, of a woman's lifespan. And I think it's something that's going to get a lot more airtime coming up. Omega-3s in pregnancy, most folks are aware that they should have some omega-3s. I think that the 200 milligrams DHA is really woefully inadequate. In Japan and Europe, we see them recommending much higher doses with neurodevelopmental impact, as well as decreased maternal and fetal cortisol stress responses. For folks that are vegan, the conversion of ALA sources into DHA is not great. You would have to have a lot of ALA, so probably supplementing with some ALA algal sources is prudent. And for some reason in pregnancy, the data really has focused on DHA in terms of brain and eye development, but EPA or eicosapentaenoic acid is incredibly important as an anti-inflammatory, metabolic health. This is what we see recommended for diabetes, hypertension, and and so many women have related disorders of hypertension, disorders of pregnancy, pre-existing or gestational diabetics. I think it's probably prudent as well to have some eicosapentaenoic acid in there, whether it's from a couple servings of that high fatty fish per week, or if somebody's not tolerating fish and wants to supplement it, that's fine too. Along that line, I see so many women with preeclampsia, and if any of you out there are practicing obstetrics, you're probably seeing this too. And there's a couple things if someone has a history of preeclampsia or risk for preeclampsia that I think are really compelling, that are worth mentioning, and that's the supplementation of calcium, either via supplement or whole food sources, and a significant reduction in risk of development of preeclampsia and development of severe preeclampsia, i.e., defined prior to 32 weeks with calcium, and for such a really benign intervention. A little bit out there for dark chocolate in terms of the theobromine, which is a flavonoid, so that's kind of fun. A little bit of dark chocolate won't hurt. And then vitamin D as a modulator of immune tolerance. Vitamin D is found in some food sources like mushrooms and then from the sun. Most people need a supplement. but reduction in a Cochrane review to nearly half of the risk of preeclampsia. So really compelling. And then moving on to perimenopause and menopause, which is my current favorite topic to talk about, and having a moment right now in the social media zeitgeist. And, I get a lot of questions on diets for menopause. And I did a deep dive into this. I just wrote a systematic review, including all of this, and looked at the literature out there. And again, like what we come back to, like I said at the beginning of the talk, is really this, whole food, plant forward style diet. Um, and that a plant based diet significantly reduces the frequency and severity of hot flashes and improving the quality of life, including sexual health, metabolic health, body composition. And that further to that, a low ish carb diet. So people go on keto diets, very low carb diets, et cetera. I'm really more of a moderate person in terms of my approach to those things, which I think is reflected in the literature. But um, favoring a lowish carb diet, and beyond that, like again, just a very high fiber, whole food style diet that really is favoring um, a lot of veggies, shows improvements in metabolic and cardiovascular risk, the body composition. I hear so many folks say, they get close to or after menopause and they're saying, I'm eating the same things. I can't, budge the scale. I don't know why I have this, kind of change in my body habitus. And this is one of the things that I've seen move the needle for folks along with strength training. Um, One of the things with a lowish carb diet is it may increase cholesterol, so that's something to keep an eye on. And then in terms of high protein diets, this is a recommended daily allowance. It used to be zero point 0.8 grams of protein per kilogram of body weight. That always seemed a little bit low to me. New is 1.2 grams per kilo, and that falls more within the range that you see in most studies of 1 to 1.5 grams per kilogram. Some will go up to 2 grams per kilogram. But that higher protein is important in terms of the prevention of age-related muscle loss, and as well as the loss of bone mass and downstream fracture risk. But it needs to have some strength training to be able to utilize that protein. And it doesn't have to be a lot, even 2 20-minute sessions per week of body weight strength training makes a significant difference in terms of prevention of muscle and bone loss and downstream fracture risk. And this is my high protein frittata recipe. Cottage cheese is not great. Nobody likes it, but it disappears into this and adds protein and really makes this taste better. And it is a great way to use up the veggies that are dying in your fridge. So the veggies can be chopped up. If they are soft or kind of wrinkly, it doesn't matter. I call this the hospice frittata for the veggies that are on hospice in your veggie drawer, and really reheats nicely too in the air fryer. And a note on soy and phytoestrogens: whole soy foods are good um, for people, and they are good for peri and postmenopausal people in terms of a modest reduction in vasomotor symptoms, decreased inflammatory markers, reduced risk of cardiovascular disease, and really should be utilized without worry, even in the setting of estrogen mediated cancers. This is a recipe for 10-minute tofu poke bowls, so utilizing those whole soy foods. And we talked about the microbiome and look at the predominance of a variety of plant-based foods in this, and the colors and textures. And it's just something that people can make individually too, so families tend to like it. The tofu, squeeze all of the moisture out of it, and then you can either sear it in a skillet to where it has like a French toast looking crust on it, like that color, or in an air fryer works well too. You can buy fermented veggies, all of this, buy the individual things and just throw them together so it's fast and can be reheated. In terms of osteoporosis and calcium, I think a lot of folks think that they need to have a lot of dairy or drink a lot of milk, and that's not true. Milk is really controversial and actually associated with higher fracture risk. I'm more into like hard cheeses, sheep's milk cheeses, those kinds of things, yogurt, fermented dairy, etc. And there's other ways to get calcium too in dark leafy greens. Um, the RDA still remains at 1,200 milligrams for women over 50, but I think that this is a table from this paper that, vitamin D is really important and probably underutilized in this. We'll see if the recommendations go higher in terms of daily value or supplementation, but really getting people up in terms of, at least that 30 nanograms per milliliter is the minimum that I'm comfortable with. And vitamin K2 or menaquinone, there's no standard recommendation, but there's a significant number of studies showing improvement in bone mineral density and that I find compelling. And just a couple slides because I don't feel that I can give a talk on culinary medicine and women's health without talking a little bit about planetary health because they are one and the same. The whole food, plant forward style diets that are good for us are good for the planet. This planetary health diet came out in 2019, developing this, and that with the global population increasing, and it's like, how do we feed all these people in a way that is sustainable for the planet and healthy for us? And it's really an alignment of health and environmental outcomes um, with all the things that we've been talking about today. You see, this is a interesting graphic, I think, in terms of the resource utilization of animal-based foods and in particular beef. So just decreasing that alone makes a big difference in terms of the carbon footprint and water needed for food resource production. And they put together this planetary health plate, and you can see it's almost exactly like um, the healthy plate at the beginning from the Harvard School of Public Health. All right, so lots of references for a talk like this, and glad to chat. Oh, you're muted, Deborah.
Thank you very much for such an amazing presentation. And um, you mentioned people having questions, but we generally will have a dialogue based on some questions. And we really hope that you fill out the survey that will be sent to you or after the presentation. And there is a place in the comments there for you to make some comments, or if you have a specific question, then that can be directed to myself or Dr. Kennard. So with that, I would like to pose a dialogue based on a few questions. And I think a big one that I come up against is calcium and calcium supplementation versus dietary calcium. And my understanding is that the 1,200 milligrams is total calcium intake. And you mentioned that dairy is actually not great for bones once bones have stopped growing in terms of bone health. Do you have some specific thoughts from a culinary perspective of calcium-rich foods?
Yeah, thank you. It is an all-comers effect with supplement versus nutritional intake on calcium. And again, like I love stuff that tastes good, right? And so like that frittata with some cheddar Gruyere on the top, like I'll put that on the sheep's milk cheeses. You and I had been chatting about the cottage cheese, and if someone is not into that or not into dairy, like the alternatives for that that are calcium rich food, a lot of people do digest sheep or goat milks dairy better. And in terms of other food sources, you get some from dark leafies. You'd have to eat a lot of dark leafies to do that, but I do think too that's where things like the cooking vegetables like in the frittata or in a soup or sautéing like greens for the protein veggie bowl, it's like if you see a whole bag of spinach, like that's overwhelming. Like you're not going to eat that. But if it's sauteed down and kind of in stuff, just, like to where you're having a serving or two at every meal, it does add up in terms of, getting 100 milligrams of calcium per serving and, trying to get it that way. Because I really prefer food first. I don't think it's probably a great idea to be taking that much calcium via supplementation.
Mhm. Yeah, and I also recommend for people almonds and certain legumes have some calcium component. So something like hummus, because also sesame seeds have it. A small handful of almonds to help get your protein up is also helpful. And firm tofu actually has some
Oh,
calcium in it
a good
because
point.
soybeans don't have calcium, but the way that you solidify tofu in soft tofu is magnesium, but firm tofu is calcium. So it does have some calcium in there. So those are some other
Yeah, that's a great point.
dietary things.
You want firm tofu anyway, otherwise it's squishy and weird.
Right. Actually, the one time that I use soft tofu is in place of cottage cheese, and it gives you that nice creamy texture.
Yeah,
And
that's
then you're
true.
getting some of the soy in your diet. And rather than people using a protein powder supplement in their smoothie, you can put a little half a block of soft silken tofu in there, and that gives you
Yeah,
some nice
that's a great
protein.
point. It's really mild flavor.
Yeah. Um, I just wanted to, you use the term glycemic index and then you also use the term glycemic load. I tend to use the term glycemic load. Let's have a little conversation about, what's the difference, or what, does it matter? What do you mean?
Yeah, yeah, you bet. Glycemic index is that particular food's footprint in terms of how much it's going to raise your sugar. Glycemic load is what all of the food together is going to do.
Right, exactly. And so like the example is something like watermelon has a high glycemic index, but in terms of what a serving size of watermelon is, the glycemic load is not that high. So it also has to do with the serving size of the food itself. I see someone in the chat mention something about oxalates, and yes, they are high in oxalates. They also are not great for planetary health. A lot of ways that they grow almonds is by using quite a bit of water. And some people have an oxalate sensitivity, but if you do not, then a small handful of almonds is a nice source. Um, and and then in terms of the power balls, you said, oh, you might add maca or ashwagandha or, some other powders. Do you want to take a minute to say like which one,
Yeah, you
for
bet.
what
I love
person?
talking about that. So, I trained as a clinical herbalist, and the overlap of utilizing food and herbs together is one of my very favorite topics. Um, So maca, I had mentioned, is a nutritive root from the high Andes in Peru, utilized for preserving muscle mass, vitality, strength, libido after menopause. And ashwagandha, super popular now, but wasn't as well known shortly before. It's an Ayurvedic remedy, Withania somnifera. You can hear the somnifera in the name. It's improvement in sleep, in the stress axis, in terms of um, cortisol rhythm throughout the day, and can have some effects too on thyroid function and metabolic health. And a lot of women really like both. Ashwagandha is nice for stress, for sleep, for that tired and wired feeling. Um, it doesn't taste great. It also literally translates to smell of 100 horses or strength of 100 horses, like depending on. So something like the power balls that have enough of their own like flavor to it, with the peanut butter or almond butter and the dark chocolate and things will mask that. But I use a lot of ashwagandha and maca in peri and postmenopausal patients with success. I think that they're tremendous herbal allies out there and very, very safe. And the power balls are a nice way to utilize it in food to where folks aren't taking extra supplements.
That's great. I have two other things. Dr. Maj, our director, actually just messaged and said, Peanuts versus almonds, peanuts have a higher omega-6, and part of the anti-inflammatory diet is trying to increase our ratio so that we have more omega-3s than omega-6. And
Mhm.
when you were talking about EPA coming from flax, the one of the enzymes that is necessary to for our body to make EPA from food that is not in fish oil, which has EPA, is competitive with the omega sixes. And um, so do you feel like you have a preference about what kind of nut, particularly in terms of an inflammatory or anti-inflammatory effect?
Yeah, I from a health perspective, I like using almond butter in the recipe. I like how the peanut butter tastes better. My kids will eat the peanut butter ones, but not the
Right,
almond butter ones.
right.
The almond butter, it depends on the brand on how oily it is too, so that's another variable. But give it a good stir and put it in the fridge, before trying to make the recipe. It's just a little bit less forgiving. Things like pistachio butter, cashew butter, really don't work as well.
Hmm. Yeah. And do you ever put any like almond flour or something in there to make it a little more sticky, or is that sort of too complicated and expensive?
Well, I have, but I find that it works just as well to add more ground flax, and I feel like that's more nutritive, so I usually stick with that.
Yeah. My other question about many of your recipes have honey in them, and honey is a wonderful thing, but it is pretty high FODMAPs and it has
Mhm.
a higher glycemic load. Does maple syrup work, or is it not sticky enough? Too
Well,
liquidy,
I love maple syrup. It tastes great if you get good maple syrup, that's like the real stuff.
right?
And um like that on a little bit of Greek yogurt, is magical and it has a better texture too, because if you put honey on something cold like that, it kind of solidifies and gets like hard to work with. Whereas the maple syrup just kind of goes around and tastes good. In terms of the balls, just because it's runny, like it won't stick it together as well. And so I'd probably add a little bit less of it and see how it goes, but it would be a really lovely flavor, I'm sure. And if I was doing that, I'd probably lean the flavor more towards like warming spices, like put some cardamom and cinnamon in there and, you know, um, raisins, or it'd still be good with the dark chocolate, maybe a little bit of orange.
Yeah. Yeah, I'm actually still a big user of maple syrup because many years ago I lived in Vermont and actually I traded some people. I did home brews and then I would get a year's supply of a lot of maple syrup. So that was my sweetener for everything. It was better for my children and but it is a little bit more runny, so you have to take that into account if you're baking or cooking with it. But it is a low
Use
FODMAP.
maple butter. Like maple butter is where
Yeah.
it's just been reduced down to be more solid. Like that would
Yeah,
work
I think
too.
it's maple sugar is I think what it's called
Yeah.
maybe, but I don't know. I know about maple sugar.
Yeah.
Um, okay. We talked a little bit about the cow dairy. Oh, you mentioned magnesium for menstrual pain. Do
Mhm.
you have to use a supplement for that, or can you, if you focus on high magnesium foods, is that enough?
It's a good question. My honest answer is I don't think high magnesium foods are going to be enough. The soil is deficient in magnesium, so even, dark leafies and legumes and things that should be high in mag, I think people would really have to be very intentional to be hitting, 4 to 800 milligrams of mag per day. And so I'm not someone that favors supplements as a knee-jerk reaction, but for mag, I think generally it's warranted.
Yeah, yeah. Um, and then you mentioned just a little bit about, well, you mentioned about higher protein, particularly as we get older. And I know that the market of protein powders is big. I'll tell people what my bias is, which is that I really feel like the digestive tract does much better when we chew our food than when we drink our food. I'm not a big fan of people relying on smoothies a lot. But certainly you can sneak some protein powder into something else you're eating to increase the protein intake. Do you have a particular protein powder, not a brand, but whether it's pea or rice or other vegan protein powders? I will say I am not a big fan of anything cow dairy, so I do not recommend whey protein powder to my patients, but I'm interested in hearing what your
Yeah, I mean, I honestly feel like all of those are kind of hard on the gut,
yeah,
and the way at least is a single ingredient powder, whereas a lot of the vegan ones have multiple things
yeah,
in them, and they tend to have more sugar in them. Or if they don't have sugar in them, then they really don't taste good and they're just like chalky and gritty. And um, I it's not something that I use or recommend regularly. Like I really am more a whole food focused person in approach. I think you and I share that. And I'm not opposed if someone's doing it and it's working well for them, but I'd want to be more curious about, okay, well, what are you eating? Like, what are the snacks and meals like? Like, how can we introduce more protein in a way that um, is, I don't know, I almost want to use the word holistic, like in a manner that, that we're utilizing whole foods rather than adding the protein powders.
yeah, yeah, I agree. And really, what I know that I do personally, and I often say to people is, even when you're having a snack, when I look at what's in front of me, I always say, "Where's my protein?"
Mhm.
And you can count, whole grains have a little bit of protein, quinoa has plenty of protein. So, it's not just what your protein-based
Mhm.
food is for your protein in your diet.
Mhm.
And if you are intentional about it, you can um, get enough protein. I'm
Yeah,
going
it's not as
to.
quick as just like dumping the scoop in, but that intentionality, like there was just a comment in the chat about tofu with smoothies. And, I like whole Greek yogurt in smoothies with nut butters and, just getting them really fortified that way. And that's what I feed my kids. And you can train kids for this too, like I'll ask the girls, well, where's your protein? And,
Right.
they know.
Exactly. Um, again, for some reason, sometimes my computer shows me the top screen to make, oh, there we go. I just wanted to also, as I'm wrapping up here, put this last slide on as we're talking. This is for how to, this time we're having people register for each session. So we have another session coming up with both Dr. Kennard and myself talking about the stress response and how that relates to hormones and the mind-body connection, and also your support of the Osher Center helps us to provide extra services, and so there is this QR code on there that we would be love to have your support, and that's also on our website. And with that, because we just have a minute left, I just want to thank you so much, Anne, for your wisdom and your time, and I love to hear all of your fabulous suggestions. And I also am very passionate about food and cooking, so I love to hear all of the suggestions. So thank you very much, and thank all of you for joining us today and for your attention. And we hope to see you again in a few weeks for session number 2.
Thank you for having me.